Hey guys, Jake Bully with Barbend.com. Today we're here with Joe Gambino from Perfect Stride, New York City, and we're going to look at techniques on how to tape the knee.
Hey guys, so quick disclaimer. Again, taping here is not for medical purposes. It's not going to solve pain. It's not going to fix any injuries that you have. So if you do have pain or injuries, please go seek out the appropriate medical provider to get that taken care of. This tape is really just going to facilitate the way that we exercise, perform in the gym or in your sport. So give this a try to help facilitate that process. Alright guys, so we're going to be taping the knee, and we're actually going to be doing a functional pattern today. So it's actually going to be the spar line, which is this fascial pattern that we see that kind of just will wrap around. So we will be starting at the inside of the knee with the tape. So we'll be applying it here, and it's actually going to wrap around, and Jake, have you turn around. It's going to end at the PSIs, which is this hip bone back here, okay? So I'm going to actually apply this tape over Jake's shorts today, just because so you guys can see it. But remember, we want all contact to be on the skin, because we're looking for this proprioceptive feedback from this tape that's going to help us move when we're squatting, lunging, and we're actually doing it to help try to prevent that knee valgus and that knee coming in when we're doing exercise. So when we're setting this up, Jake, I gotta face the camera again. Again, we always want to make sure we're rounding the edges. All right, it just prevents us from getting stuff caught on your clothes. 2 inches, 2 to 3 inches for the anchor. All right, you're just gonna peel it off like so. There's always no stretch on the anchors. This way they kind of stay in place. So we're just gonna come right to the inside of the knee. All right. You can kind of almost like measure your line of where you're gonna go. So here's his hip bone back here. I'm gonna come from here, and boom. So this is gonna be the path that I want my tape to take. You're gonna apply that down. Give it a little rub so that it sticks. These adhesives are heat activated. So give it a nice little rub to get that to stay on a little better. We're gonna peel back. This one, usually when I'm doing this kind of taping, the spiral taping, I don't really add any stretch at all. It's just easier to apply, and without research saying that there's any real specifics in percentages that we need, I don't think we really need to. And then you're pretty much just going to pull the backing, slide that tape up your path right over to that hip bone, and there you would have spiral line taping for the knee. So if you're having difficulty squatting, knees collapsing in, lunging, whatever exercise you would have, you start from the inside of the knee, wrap your way up to the back of the hip. Alright guys, so we're going to be taping the knee again. With all taping, we want to round the edges. It just prevents things from getting caught on our clothes. As far as what we're doing with the tape here, we're looking to just kind of give the knee a little support in the sense of stability. Right, every time we put this tape on skin, we get this little kind of stretching feeling. It's kind of like a light touch to the area, which will reconnect our brain to the area. So when we have pain, we have this lack of stability, you feel like the leg's just not underneath you properly. A lot of that has to do with proprioception and feedback from the brain. So we can easily get that connection using tape. All right, for application, we're gonna start with the knee bend, because we always like to have stuff on stretch when we're applying. We want to have a 2-inch backing on the tape as our anchor, which is going to have no stretch to it. And we're going to start right underneath the kneecap, and you're going to give it a little bit of an angle. Rub that on to get it activated, the heat activated, so it sticks a little bit better. And then we're going to peel back, leave another 2-inch anchor on the other side. We're going to apply a 25 to 50% stretch. And then we're going to kind of come up, and we're going to circle around the kneecap, and then we're going to come up the thigh. We'll take our other piece, again, same 2-inch backing. We start right underneath the kneecap again, on that angle in the opposite direction. We're going to peel on back. That same 25 to 50% stretch, and then we will circle around the kneecap. Come on up, get this teardrop type shape. And there you have this general application for the knee. So then we have two different taping techniques for the knee. To differentiate why we would do each one, this taping pattern here is going to be more of just this generalized, there's maybe nothing specifically wrong, but you're just feeling there's like no stability there, or maybe even you have some pain kind of below the kneecap here or on the top of the kneecap. This will kind of give you this generalized support and proprioception to the area. If you do have pain underneath here, you could even use a decompression strip and just kind of come across with one piece here. Okay. The other taping pattern that we did, where we started from the inside of the knee and we kind of wrapped up to the back of the hip. That one's more of a functional pattern, and that we're pretty much using that taping pattern for those people who have knee collapse in their squat, in their lunge, or anytime they're doing the lower body exercise, right? So we're trying to use that tape to kind of pull our knee, in a sense, outwards. So this way, as you're coming down, if your knee starts to come inwards, you're gonna feel pulling of that tape, and it's gonna just remind your body and your brain to keep that knee outwards and not fall inwards.
This has been Jake Booley with Barbend.com, and a big thank you to
Joe Gambino from Perfect Stride PT, and there you have two ways to tape up the knee.
If you need to find out more details, or if you just want to read more about both of the techniques we showed in this video, click on the link below or visit us at Barbend.com.